Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. So Nasacort is also known as a generic name called Triamcinolone nasal spray. So this medication is known as a steroid inhaler, and it's used in treating stuffy nose as well as sinuses in patients who are experiencing allergies or any seasonal form of weather changes that kind of leads to stuffy nose or flu-like symptoms. So these patients may benefit from taking this medication, most especially if it is attributed to allergies. So how do you take this medication? So usually you want to start with about 2 sprays in each nostril once a day. So like I said, 2 sprays in each nostril once a day. And once you start seeing changes in that symptoms, you can kind of taper it down to about 1 spray in each nostril once a day. So like I said earlier, this is a nasal spray and it is a steroid inhaler that's used in patients to treat allergies. I haven't personally used this medication before, but I've seen patients get it as an alternative to Flonase, or what is called fluticasone. So this medications are all in the class of steroid inhalers, and most likely they work almost the same way. So what are some side effects of this medication? So some side effects of this medication include headache. Patients may also notice an increased eye pressure. Some patients have noticed pain in the eye or flu-like symptoms such as headache, fever, chills, or runny nose. Also, patients may notice some burning, stinging, or soreness in the nose. As you know, this is a nasal spray that's going in your nose. So depending on how well your nose is able to tolerate it, you might get some irritation, and this may come in form of that burning, stinging, or soreness sensation in your nose. Also, you want to make sure that you're watching out for dry nose or dry throat. As you may know that when you spray a nasal spray, it kind of drains into your throat. So it can kind of irritate your throat and cause those symptoms. And also, usually with this side effect, it's not all inclusive, so you may notice it, you may not notice it. It really just depends on how well your body tolerates the medication. So who are the patients that should not be taking Nasacort as their nasal spray? So patients who have acute asthma, let's say you're having your asthma flare up, this is not a medication that you want to take for an immediate symptom relief. You have to kind of give this medication some time for it to work before you start noticing changes in your breathing or kind of that allergy symptoms that you're feeling at that moment. So in patients who are also getting live vaccines, this medication is not recommended due to the fact that the medication is a steroid. It's not recommended to get a live vaccine while you're taking this medication because it can increase the risk for infection, and it can kind of increase that symptoms of that vaccine that you received, and that's one of the reasons why we don't recommend it while you're taking this medication. Also, you want to make sure that if you are noticing any fever or symptoms of infection, make sure that you're reporting that to your doctor. I would recommend that before you inhale this spray, make sure you prime it. By priming it, you want to make sure that you're spraying about 6 sprays in the air to make sure that the spray is working before you insert it in your nose and spray it. So usually you want to make sure that you're priming it before taking it for the first time, or if you've had the bottle for about 30 days and you're trying to reuse it, you want to make sure that you're priming it as well. Or if you just left the bottle open for about 5 days or more, it's recommended that you prime it by spraying it in the atmosphere about 6 times before inserting it in your nose to spray it. So as I said earlier, this medication is a once a day nasal spray. So you don't want to spray more than once a day. And you want to make sure you're consistent with how you're spraying it daily, in terms of giving it that 24-hour gap before you spray the next spray. Also, you want to report if you're having any redness in your eye, or if your eye becomes sensitive to light, or if you start developing any changes in your vision or pain in your eye, then you want to make sure that you're reporting that to your doctor as soon as possible. Also, there is a rare side effect with this medication, which is in terms of mood changes. Because it's a steroid inhaler, one of the side effects that it can cause is like a behavioral or mood changes. If you start noticing any worsening new behavioral changes or mood changes, then you want to make sure that you're reaching out to your doctor to make sure that it's not, a pre-existing condition that you may have, and it's directly attributed to this medication. That way you can stop the medication and try another alternative, or what you can do is stop the medication and go the homeopathic route, which would be your saline nasal spray, which you want to kind of run it through your nose. And with the saline nasal spray, you can actually use that more often during the day to kind of clear out your nose, your sinus area. That way you're not having that consistent allergy symptoms. All right, I hope I was able to help in terms of what to look out for while you're taking this medication. I believe it's allergy season, and a lot of people are going to be having like flu-like symptoms, runny nose. So you want to make sure that you're taking medication that will help control that symptoms. That way it doesn't affect your daily living activities. All right, if you did enjoy this video, make sure you hit that thumbs up, as well as subscribe to our YouTube channel in order to support our community here at Demi RX Care. Also, we offer services such as medication consultation as well as health consultation, or if you have any urgent question regarding what medications you're taking, any medication interaction, please feel free to check us out at DemiRxCare.com, and we're more than happy to answer any question that you may have regarding whatever health concerns that you have. Thank you so much for watching, and stay tuned.